institutions. That said, let me explain why nonpartisanship, what that truly means to us. In these days of hyperpartisanship, some of you have heard me say this many times, it's important to understand a distinction, to clarify how we approach nonpartisanship. First, when candidates are running for office, our nonpartisan policy remains clear. We don't endorse or oppose candidates or a political party. By providing voters with information on where candidates stand on key issues, hosting nonpartisan forums, you'll see some of those coming up, and working to ensure every eligible voter has access to the ballot. The League's goal is to empower voters with facts, not to tell them who to vote for. Once individuals are elected, they're no longer candidates, really. They're public servants. And we should be the boss, right? Responsible for representing all of the constituents regarding a party. Holding elected officials accountable to the public interest is not a partisan act. It's a vital function of a healthy democracy. When we advocate for and against policies based on our missions and our values, we do so from our commitment to those issues and strengthening civil institutions, not out of allegiance to any political party. Thank you. That's what gives us agency, and it's time to make sure that we clearly understand that we are a political organization. Because we're nonpartisan does not mean we're neutral. We're eager to hear from Representative Fragala because our chapter has been studying healthcare disparities in Lane County. You'll have that information out in a month or two, including the absence of a hospital and emergency room here in Eugene, and the prevalence of healthcare deserts in rural areas. Representative Fragala has sponsored bills to explore the use of technology and workforce development to improve health outcomes and to protect the privacy of those seeking reproductive and gender-affirming care. County Commissioner Lori Traeger is here to introduce her. Lori was raised in Philadelphia, but she's lived in we don't hold that against you. She's lived in the Lane County's District 3 for nearly 40 years. She's got deep roots here and is now watching her twin grandsons grow up in the community she calls home. She brings to the county her experience as a mother, a former foster parent, low-wage worker, nonprofit professional, active community volunteer, and an advocate fighting for better working conditions for women and better futures for families. Please welcome Commissioner Traeger.
Thank you, Terry. Thank you to the League for hosting this and for everything that you do to keep community cohesive and together in a time when there is so much that is fractured and there's so much mis and disinformation. It's great to see a room full of folks who are committed to getting good, clear information about what's happening in the community. I'm going to read you a bit of an introduction about Representative Fragala, but I've also taken the liberty to add a little bit to it because I can't resist when I'm on a microphone sharing a little bit about what the county does and also why I am particularly pleased and honored to be the one invited to introduce Representative Fragala. Lisa Fragala has called Eugene home for over 30 years. Before being elected to the Oregon legislature, she worked as an educator for over 25 years, first as an elementary classroom teacher and then at Pacific University's College of Education. Lisa served on the Lane Community College the Lane Community College Board of Directors from 2018 until 2024, including serving as chair for 2 years during the COVID pandemic. She was appointed as a member of the City of Eugene Planning Commission in 2017 and served there until starting in the state legislature in January of 2025. As a member of the City of Eugene's Planning Commission, she worked to help identify housing solutions for the City of Eugene and the broader community. Lisa ran for the state legislature because in her role as an elementary teacher, she saw firsthand the struggles families face with housing and food insecurity. Her service in local government also provided her with the understanding that it is possible to make a positive difference. Elected to the Oregon House of Representatives in November 2024, Lisa recently finished her first term in Salem. She is currently a member of the House Labor and Workforce Development Committee, the House Education Committee, and the House Housing and Homelessness Committee. She's proud to have recently been appointed to the Oregon Women's Commission and to serve on the leadership team. I was pleased to be asked to introduce Lisa, and I want to take another few moments to share why. The role of county government is to deliver essential services directly to the people. Nearly all of these functions are done under the direction or mandate of state legislation and administrative rules. So as a county commissioner, it's crucially important to me that I have solid working relationships with our state legislators. County government acts as an arm of the state of Oregon. We are the designated housing authority for Lane County, the county public safety entity with programs like the Sheriff's Office, rural patrols, jail operations, parole and probation services, and juvenile justice programs, and the Office of the District Attorney. We are the Office of Assessment and Taxation for the county. We hold mandated responsibilities for emergency management like disaster planning, response, and recovery. We run County Elections Division and maintain a park system of nearly 70 parks, and we are tasked with ensuring our land management programs comport with all 19 of Oregon's state land use laws. And of course, for the purposes of today's discussion regarding health care, it's most notable that by state statute, your county government is your public health authority and your behavioral health authority too. We are fortunate to have such strong, trusted local delegation in Salem, and with Lisa joining that delegation, we all benefit from her insights, experience, and dedicated public service. On a personal note, I'll add that I've known Lisa for many years. I've seen her show up time and time again to stand with people working for healthier and more just communities. And as a resident of House District 8, voting for her was one of the easiest ballot bubbles I've ever had to fill in. So it's my pleasure and my honor to ask you to please join me in giving a warm welcome to my friend, my colleague, and my state representative, Lisa Fragala.
Might need a moment to get situated here. I think so. We'll figure it out. All right. How much can I move this? All right. Can you hear me okay? Okay. No. Yes. I'm hearing multiple and okay, want to get into the black one. Great. All right, good. So, excited to be here with you today. Feels like a very friendly room because when I look out, I see so many people that I appreciate and respect. So thank you for the invitation. Thank you to Kitty for extending that invitation and getting me here well prepared. And thank you to Commissioner Trieger for that lovely introduction. We work together frequently on many of the issues that I'm going to discuss today, and we couldn't have a better person representing us in terms of healthcare and many other issues that are important to families on the County Commission. I was also curious if Representative Nathanson is here today. I'm not seeing her. Okay. Also, another fantastic champion for healthcare. All right, so as Lori mentioned, we have a really strong delegation. So many of you know me, and you heard from my introduction that I'm an elementary teacher at heart. I taught kindergarten and second grade, and I have had a lifelong passion and commitment to ensuring that we have resilient K-12 schools and a higher education system, especially community colleges. Community colleges have a special place in my heart. So, you know, when you work with young children, you get a really intimate perspective of families' lives, right? They will tell you anything and everything, especially those 5-year-olds, right? And I could see how the families I worked with struggled, how they struggled with housing insecurity, how they struggled with food insecurity, and how they needed better wraparound services and access. So As a state representative, some of the major policy areas I work on are housing and education. Yet I'm here today to talk about healthcare. So I want to share a little bit of my story and why I have become so involved in healthcare policy at the state level. I am not a doctor. I am not a nurse. I am not an expert in healthcare economics or management, but I am passionate about healthcare as a basic human need or necessity. And I strongly believe it is a human right. So I'm very proud that in Oregon we have a constitutional amendment that gives us the right to access health care. We have a constitutional right to access health care in our state that the voters put there, right? That is a guiding principle for me every day in the work I do around this policy area. But let me get back again to my story a little bit. And I know some of you are aware of this story. In the summer of 2023, I was diagnosed with a fairly aggressive form of breast cancer. And earlier that year, like many people in our community, I'd received a letter from the Oregon Medical Group saying that my primary care provider no longer worked here, didn't say where they were, and didn't tell me if I was going to get a new doctor. So when my mammogram showed several masses, I did not have a primary care physician. I am sure you can imagine the fear I experienced about my next steps and the anxiety I had about who would help me navigate my healthcare decisions. And I'm sure many of you know this as well. Fighting cancer is a master class in having to navigate our healthcare system in this country. And it is very challenging, more challenging than it should be for anyone. So fortunately for me, I was eventually able to get the care I needed. But there were many people in our community that were significantly impacted by what happened at Oregon Medical Group and Optum, had significant impacts to access to quality care. There are still many people who are continuing to struggle with access to quality care due to the way our healthcare system is structured, and I would say due to the way corporations are vertically integrating care in our system. So when people started asking me in early 2024 to run for the state legislature in the position that Paul Hovey had vacated, I knew I wanted to run, and I knew that healthcare would be one of the issues that would be central to the reason why I was choosing to run. And I have to tell you that when I knocked doors throughout my district, housing was definitely one of the top issues, but I met so many people who told me their stories about Oregon Medical Group and Optum, and I had incredible conversations with people on the doors about their own cancer journeys, right? I cried on the doorsteps with people, right? And it even more firmly strengthened my commitment to working on this issue, to making sure that people can access health care. So that's why in my first year as a state representative, I was honored to be asked to work with Majority Leader Ben Bowman on Senate Bill 951. Senate Bill 951 addresses the previous lack of regulations on corporate ownership within our healthcare system. So it's Oregon's corporate practice of medicine law. Corporations aren't supposed to practice medicine. Doctors or healthcare providers should be practicing medicine. And when we see corporate consolidation in the healthcare market, we see three things happening. And I think Optum was a really good example of this. We see decreased quality of care. We see decreased access to care and research increase costs, and that is simply unacceptable to me. So Senate Bill 951 curbed the influence of corporations in our healthcare system and reduced threats to access and the rising costs of care. So it essentially reinforces Oregon's tradition of local control in healthcare, with medical decisions being made by licensed providers and patients. So at the heart of the bill is something really, really simple. It's the idea that medical care should be between a doctor and a patient, and that decisions that intimately affect patients should not be made by corporations for profit. So Senate Bill 951 closed significant loopholes in Oregon's corporate practice of medicine law, sometimes we affectionately call it CPOM, that were being exploited by multi-million-dollar corporations and private equity firms. Senate Bill 951 was a landmark piece of legislation in Oregon that is being looked at by other states across the country for implementation. And I'm proud of the work we accomplished. And we've seen positive outcomes in other parts of the state already in just the last year, where takeover of primary care doctor practices by MSOs, which are corporate management service organizations, these have been prevented. So what happened here in Eugene with OMG and Optum has been prevented in other communities. But it's not the end of the story, is it? So I've commented to many of my colleagues in the state legislature that we are the canary in the coal mine in the Oregon healthcare system here in Eugene. I've actually heard other people repeat that at times in the last year. And unfortunately, here we are again in Eugene, impacted once more by corporate private equity intrusion into our community healthcare system. The decision by Peace Health to eliminate their contract with the Eugene Emergency Providers, or EEP, and to contract with an out-of-state corporate MSO, Apollo MD, is a disaster for our community. And it is the first significant challenge in the ways in which we tried to strengthen Oregon's corporate practice of medicine laws in 2025. So I'm going to guess the majority of people here today are familiar with what's happening at Peace Health. I know this is a very well-informed crowd, seeing a lot of head shaking. So I just want to say, I personally believe that Peace Health and Apollo MD are in violation of Oregon's corporate practice of medicine laws. And I've called on them publicly to reverse their decision, or at the very least delay any transition steps from moving forward. Numerous local elected leaders, including Commissioner Trieger, our local delegation of state representatives and senators, our mayor, and the governor have all asked them very directly. So we need time to prove that the Peace Health Apollo MD transaction is in violation of Senate Bill 951. We need time to demonstrate that the relationship between Apollo MD, which is a corporate MSO, and the newly formed Lane Emergency Physicians they are working to establish is in conflict with the prohibitions on straw doctors or friendly physicians in Senate Bill 951. And I do think that that's what is happening, no matter how much this corporate MSO wants to try some workarounds here. So at this moment, the means of enforcement in CPOM, in Corporate Practice of Medicine statute, is a private right to action. And fortunately, Eugene Emergency Providers are getting the support they need, and they filed a lawsuit against Peace Health for being in violation of Senate Bill 951. Unfortunately, The court system takes a long time. And while that is happening, we could lose EEP as physicians begin to make decisions about employment based on the well-being of their families, right? That's something they don't want to do, but they need to do. So this is where I think Governor Kotek and the Oregon Health Authority need to take action. Myself and other elected leaders have been in communication with the governor's office about the steps she and OHA must take to both encourage and compel Peace Health to either change their decision or delay the transition until a full healthcare market oversight review can occur about the Peace Health Apollo MD transaction. And I'm committed to continue to work with the governor's office to address our community's crisis with accessing emergency health care, as well as committed to planning what are the next steps to make sure this can't happen again, and what do we need to change in our corporate practice of medicine. Because unfortunately, corporations are really good at finding loopholes and workarounds. So the EEP crisis highlights some of the ways we can build upon the work we did on Senate Bill 951 in 2025. And we're already having conversations about what can be done, but there are two obvious areas that we're considering right now: strengthening enforcement mechanisms and strengthening HCMO, or the Healthcare Market Oversight Program. So originally, when Senate Bill 951 was being drafted, there was a very strong interest in providing the Department of Justice and the Attorney General with the ability to have an enforcement mechanism. However, we didn't pursue that because the concern was it would have a fiscal, and it could have potentially gone to Joint Ways and Means and just disappeared in the budgeting process. That happens to a lot of good bills. So we felt like it was important to strengthen the law and then to come back and make those tweaks. So we have the strengthened law and statute, and now we need to build on that statute and add an additional enforcement mechanism. The second piece with HCMO, the Healthcare Market Oversight Program, which launched in 2022 under House Bill 2332, is an OHA program, and it reviews significant healthcare business transactions, such as mergers and acquisitions involving hospitals, large healthcare providers, insurers. Its goal, here is what its goal is to ensure transactions do not negatively impact affordability, access, or quality of care. Those three things that I mentioned earlier. Unfortunately, HCMO is voluntary for hospitals like Peace Health, and this is absolutely something we need to change. The governor has directly asked Peace Health to not do this, to take a step back and slow it down, and they have said no, right? And OHA doesn't have a lot of authority to compel. So I don't believe we should have to pressure Peace Health to get them through a HCMO review in a scenario where a community's access to care is so clearly threatened. And there needs to be an option for the governor or OHA to compel a HCMO review when a healthcare transaction is negatively impacting access to care in Oregon. And this is legislation that I want to look at in 2027. So I'm sure there'll be other changes we need to make to Oregon's corporate practice of medicine, so stay tuned. There'll be more to come. But I also wanted to switch gears and talk a bit about the 2026 legislative session and some of the issues we tackled successfully. It was not a typical short session. Usually short sessions are like technical tweaks, balance the budget. We did some really big things in this short session. And there were some good wins for healthcare, particularly for access and affordability in our state. Representative Nathanson successfully passed House Bill 4107 to require urgent care centers to basically be regulated. They weren't regulated previously. That they should have to adhere to specific standards, make certain information available about the type of care they provide, and to provide patient records to emergency departments, because often patients are going there. So this is a great step in increasing access that's decentralized, right? We need good decentralized care, like many other countries have. We also passed House Bill 4127, which essentially creates a mechanism for fee-for-service to make payments to Planned Parenthood so that we don't lose comprehensive reproductive health care and primary care services for thousands of Oregonians across the state. Planned Parenthood funding was specifically eliminated by the federal government as part of H.R. 1 in what some people have called the Big Beautiful Bill. But 4127 will stabilize access to care for thousands of Medicaid patients, and I was proud to be a co-sponsor of that bill. So here's something that is, it's a resolution, but it provides critical guidance to how we navigate policy and decision making. HCR 2002 declares a state policy goal that by 2033, all Oregonians have access to quality, affordable health care services, and that the health care system is easy to access and navigate. That is in statute. So it's a resolution, maybe not necessarily statute, but it provides critical guidance for us as a state legislature to work towards what we have in the Constitution, right? We need guardrails to make sure we are working towards that constitutional right to health care. There were also several pieces of legislation that decrease the cost of care and increased access. So for example, legislation that ensures that doula and lactation counselors are covered by Medicaid and health plans, right? We know that improves outcomes of children. Legislation that requires state-regulated health plans to cover preventative health care services. Preventative, right? Imagine that. Such as immunizations, right? And another bill that prohibits insurance companies from imposing deductibles, co-payments, or out-of-pocket expenses for cervical cancer screenings. These last two, I think, are really important to talk about in conjunction together. Cervical cancer is one of the most easily avoided types of cancer now for young people. They can get vaccinated for it, right? So they can get immunized, as the previous bill discussed. It is also one of the most lethal forms of cancer for women, if not detected, right? And so we have a preventable form of cancer that can be treated if it's detected. So both of these work together to do that. And then finally, one of my personal bills in the last session was House Bill 4088, which had a very unwieldy name, the Strengthening Patient and Provider Privacy Act, and it basically increased protections for reproductive care and gender-affirming care in Oregon. It strengthens Oregon's SHIELD law to protect healthcare providers and patients from federal government and out-of-state investigations and prosecutions. It also strengthens important privacy protections. So for me, the bill was really about privacy, healthcare as a human right, and bodily autonomy. right? I really believe we have the right to have our private personal health information protected when seeking legal protected health care, that everyone deserves access to medical care free from stigma, interference, or surveillance of our personal information, and that we need to protect our ability to make informed decisions about our own bodies, our own health, and our futures. So we had some fairly strong policy wins in the 2026 legislative session, but we also struggled, and probably the biggest struggle, and it's not gone, it's ongoing, were budget challenges. And healthcare is an area that we will be struggling with and severely impacted for the next 5 to 6 years. Federal budget cuts in H.R. 1 left in just this current biennium an $800 million budget deficit in Oregon's 2025-2027 budget, which we're constitutionally obligated to balance. And that was an important priority in this session. We did successfully balance Oregon's budget in the last session with a combination of agency-level cuts and by disconnecting from federal tax loopholes for billionaires and large corporations. For the Oregon Health Authority, this still meant close to $100 million in agency-level cuts. That is because healthcare is one of the largest pieces of our budget. Healthcare, education, and human services. Those are the three big pieces. Coming in fourth is public safety. So, still significant, but more significant cuts were avoided. I felt really proud of the work we did on the budget. There were really scary things on the chopping block that we were able to not do because of the disconnect package that we passed. However, nationally, future cuts to federal Medicaid funding are significant. And they represent approximately $1 trillion nationally over the next 10 years. This is about a 15% decrease in Medicaid funding overall and represents a very, very serious challenge for Oregon as well as many other states. So there are some key elements in these federal cuts that need to be understood. So first of all, there's just direct funding cuts, right? To the Medicaid system. For Oregon, this will be somewhere between $530 to $600 million in the 27-29 biennium, with additional losses in the following 2 years. There are also reductions to our state's ability to use provider taxes for funding Medicaid services. So this is an area we've been incredibly creative with in Oregon. And we've worked collaboratively with hospitals on the state's hospital provider tax. They are supportive of it because it's historically brought more federal funding into the state. So limits on the state provider tax to help fund Medicaid will greatly hinder our state's ability to fund programs. It represents a $603 million reduction in the 27-29 budget cycle, on top of what I already described, and a $1.7 billion loss in funding in the 29-31 budget cycle. Sorry, folks, it keeps getting worse. It's not a good story that we're facing. So H.R. 1 also increases administrative costs for implementing Medicaid programs. And when I'm talking about Medicaid, I'm talking about the Oregon Health Plan. And it compounds the financial challenges. It mandates more frequent eligibility checks and implements stricter reporting requirements, which, by the way, are designed to make it more difficult for people to access care. And it simultaneously reduces funding for implementing renewal and enrollment processes. And so these two things will also result in increases in state level costs to implement our Medicaid program. So for Oregon, the total projected impact to Medicaid funding the state faces is a total loss of $11.7 billion in federal Medicaid funding over the next 5 years. 6 years if we think of 27. Kind of worked it out for 27 at this point. The Oregon Health Authority estimates that somewhere between 200,000 and 500,000 Oregonians will lose coverage. And that is usually representative. A third of that will be children, if not more, who will lose access to health care. So this is something that will be a critical challenge and a critical priority for us to figure out in the coming biennium and in the coming years. So not going to sugarcoat it. There are going to be a lot of difficult decisions ahead of us as we work to balance Oregon's budget and we fight to preserve access to health care in our state. So what can we do, right? That's something we're really thinking about now. So some states are looking to reduce reimbursement rates to hospitals and providers to manage lower federal funding. Unfortunately, this strategy seriously threatens the financial stability of healthcare institutions who may not be able to cover costs to the care they are providing. This is what we heard from Providence about why they could no longer be a CCO in our community, right? That's what resulted in the big transition to Trillium. In Oregon, we're also seeing small regional hospitals struggle. Ashland lost their satellite hospital, and in the last session, we provided $50 million to the Bay Area Hospital in Coos Bay so they wouldn't lose their hospital. Can you imagine living in Coos Bay and not having a hospital? I think Eugene would have been the next closest trauma 2 level hospital available to them. Some states are also proposing assessments or fees on large businesses with high numbers of employees who receive Medicaid benefits. So think of a company like Walmart. They are able to keep their expenses down by not providing benefits to their employees, but their employees are probably on the Oregon Health Plan. And so these fees are sometimes called fair assessments, and they recognize how these companies benefit from public health care programs, but they don't contribute or they don't invest in them. States like Colorado, New Jersey, Massachusetts are already pursuing this strategy. In the 2026 legislative session, which we just finished, there was proposed legislation that would have studied how significantly this is occurring in Oregon and would have given us a picture of who those large companies are. It would have set the groundwork for a fair assessment, a fair share assessment, but it didn't successfully pass. I still think we will be looking at legislation in this area, and I actually am very supportive of making these large corporations pay their fair share for health care. And then finally, to help address the challenges ahead, Governor Kotek has convened a Blue Ribbon Commission. I don't know why it's called that. Come up and tell me later if you know why. It's special, right? To explore how Oregon should prepare for reduced federal funding for Medicaid. So she initiated this last November, and they've met every 2 weeks since then. They're supposed to make recommendations due to the governor this July in 2026. So she's taking this challenge very seriously. A significant responsibility of the group is to recommend changes to Oregon's Medicaid program or the Oregon Health Plan to achieve sustainability while preserving access to services and care. Some experts also believe that we'll have to make a reduction in benefits covered by Medicaid And this will likely help reduce the budget hole that we have. I'm hoping that we can limit how we do that and find other sources of revenue to help us sustain the program. So some good news in there. Started off strong, and there's a lot of challenges that we have ahead of us. Somebody once told me that the Oregon State Legislature is about incremental change over a long period of time. But I'm not sure if we find ourselves in a place in history where we have that luxury, where we have that time to approach problem solving incrementally. It may be time for more groundbreaking thinking and for implementing significant changes to how we approach healthcare policy in our state. So I want to end on an idea that may be the right moment in history to consider. The idea that Oregon could be the first state in the nation to implement universal health care. The idea that we could have access to health care for everyone, regardless of income, age, or health status. It's an idea that would lead to better health outcomes for children and people of all ages and higher life expectancy that can increase equity in healthcare access and represents greater economic stability for families. It's an idea that Oregon is working on. The Universal Health Plan Governance Board is a state entity launched in April 2024 and is tasked with designing a publicly funded statewide healthcare system. It aims to ensure equitable, universal coverage for all Oregonians with a comprehensive implementation and financing plan due to the legislature by September 15th, 2026. So, does anyone know what the state motto for Oregon is? That's right. Our official state motto is "She flies by her own wings." So just say with me in closing, we fly by our own wings. One more time. We fly by our own wings. Thank you. So I remain hopeful and committed to fighting for access to health care in our state. Thank you. Thank you. Yeah. Yeah. Okay.
That was fantastic. Thank you very much. We have a Q&A, so somebody will come around and pick up those. I'll be asking questions. Lisa will be answering them. But before I do that, I want to introduce Lou Siniger. Lou, come on, stand up. Lou has been working on healthcare for all Oregonians for many years, and he's put some flyers on the table for you in terms of some interest in things that are coming up. So thank you for coming, Lou. Thank you for being here, and thank you for your long-term dedication to a different healthcare system that really works for all of us. Got some questions? Okay, just out of the box. How does the new corporate practice of medicine impact the Optum acquisition of OMG that has already occurred?
So unfortunately, the law was passed after an MSO acquired, Optum, the MSO, acquired OMG. So we can't necessarily go back in time around these healthcare transactions when it comes to the state law, very unfortunately. But the healthcare model moving forward does need to comply with state law. And so Optum and OMG should be in compliance with the corporate practice of medicine in regard to that central foundational piece, which is that the corporation cannot be making decisions about the amount of time that doctors see their patients, about making decisions about the type of health care that you receive. The doctors or the physicians need to be in charge of those decisions. And so that is what still applies. The other piece is that I think one of the things that was really significant for our community were the agreements that Optum had required healthcare providers to sign, non-disclosure agreements, right? There's a whole variety of those that occur within the healthcare industry. Those are no longer permissible under Senate Bill 951. So they can no longer require those. And then Representative Nathanson also passed legislation in that same session that passed additional requirements that prohibit those types of things from happening. So some of the things, we can't undo the transaction that occurred between Optum and OMG, but we can require that they are in compliance going forward with the statute, and that doctors and patients have control over the decision making around their health care. Additionally, I think if we strengthen the HICMO process, that could also give us some more leverage in how those how we look at those transactions that occurred in the past.
Do you know the current legislation regarding medical deserts in rural areas? One of the things that the League has been studying, actually, and discussing is really access to services in rural areas. So this is of particular interest to us.
So at the state level, we are kind of the pass-through for a lot of funding in this area. There have been challenges with funding directly to healthcare providers that support healthcare in rural communities. We did manage to shelter much of that in the process of going through the budget cuts. We also were able to get a pretty large grant from the federal government around rural health care. So for us at the state level, it's really about ensuring that these regions in our state still have the healthcare infrastructure. And that is things like the small regional hospitals. That is the other forms of healthcare access like Planned Parenthood. Planned Parenthood provides significant access to healthcare in rural communities, sometimes the only reproductive healthcare provider in a county. And then we also have our FQHCs, our federally qualified health centers, which are administered by our county governments. And so I might let Commissioner Trieger answer that question as well. I think it would be very helpful to hear from the county on this one.
Thank you, Representative. In the interest of time, I will just say we opened our first rural FQHC last year in Cottage Grove in partnership with Lane Community College, and so Rep. Fragala, when she was a board director at the Lane Community College, did a lot of work to help us with that. So that's critically important. Lane County is the primary medical home for 30,000 people in Lane County on OHP. And so opening that Cottage Grove clinic is critically important. This is a whole topic of its own, but the one thing I will add that Lane County is also working on that is critically connected to healthcare access in rural communities is broadband access. Because with the advent in more telehealth and telemedicine, which is a key way to keep rural communities connected to their healthcare providers, we have to have better and more connected and faster broadband out in our rural communities.
And if I could just add one more thing. We have Dr. Marge Hamilton here with us today, who was the president at LCC when I served on the board. That federally qualified healthcare center would not exist at that Lane Community College owned building if it hadn't been for her leadership. So.
It's a nice shout out. Thank you. Thank you for being here. How helpful or realistic would a Pacific coalition of states, California, Oregon, Washington, be in addressing this upcoming healthcare crisis?
I actually think there's a lot of potential in that, and I'll say why. So if you think back within the last year when we were having problems getting access to COVID vaccinations due to, hopefully shenanigans isn't too partisan of a word, shenanigans at the federal level, we formed a healthcare alliance with Washington and California, and Hawaii has since joined, and made the decision that we're going to set our own policy and protocols around vaccinations and not rely on the federal government. It was a very quick turnaround in how soon we started seeing access to vaccinations, like literally within a week in some places. And so I do think there is potential in this area to collaborate in other ways. And that's not only around healthcare, right? We are very fortunate to have already strong collaborative mechanisms in place with California and Washington. And so I think that the West Coast Health Alliance is something that we can absolutely build on, particularly when you start to look at how you think about the healthcare market, or when you think about insurance providers, or like, let's make a West Coast universal healthcare system.
Lisa, do you know how fast the number of participants in Medicaid OHP is growing?
I do
Not. That's a question for OHA. Okay. Is there any chance of cutting the kicker to pay for... I think this is a loaded question, but the kicker to pay for health care, education, and housing. Mm-hmm. You're going to hear it here first.
In the last session, Senator Przanski had a bill that was a referral to the voters to change the Constitution. The kicker is in the Constitution. That's what makes it so hard. And it would have adjusted the way that the kicker is dispersed. So up to a certain amount, I think it was $3 million, that would still go to the citizens of Oregon. And then above that, the money would have gone into a special fund for education and wildfire prevention. And we defined education specifically as K-12 and community colleges. I gave them a little bit of heck when I heard it was only K-12. I'm like, what about community colleges? So that did end up in there. You know, the kicker is still incredibly popular across much of the state. It's not in my district, which is, you know, makes me kind of an outlier. But it would be very difficult to completely get rid of it because it's got to go through a ballot measure. But I do think there are things we can do in terms of, like Senator Przanski's bill. There are other legislative avenues that we can pursue. There was legislation in the last session that was a modernization of the process for estimating the kicker. And so that, you know, that would help. And that didn't pass, unfortunately. And there has been previous legislation that has looked at redefining who gets what. in the kicker, right? Because there's a small group of very wealthy people that get a massive tax break. And then the rest of us get a small tax break, right? And so if we capped it or we limited it, that would be another way to address it. So there are a lot of thoughts about how to address the kicker. There are a lot of people in state government that want to do something about the kicker, but it's very dependent on the will and the voting outcomes of Oregonians.
We have a few more minutes here. So, is there consideration to create law in regards to dental support organizations, similar to medical support organizations, decreasing quality of care, dental care, increasing costs?
That's a really, really good question. I don't know offhand if anybody has thought about that. And I'll be honest with you, I don't know if that's covered in the corporate practice of medicine law. So what I can say is that we should be looking at that. And I will maybe steal that card and take it back with me and ask questions, because we will be starting a work group to look at how we'll strengthen our corporate practice of medicine laws.
Great, thanks, Lisa. So I have I have 4 questions, all related to Peace Health.
Oh, yay.
So, didn't Peace Health deny any idea isn't there any way to postpone the Apollo takeover? What can be done to stop this? 2027 is too late. If the AG cannot enforce Senate Bill 961, is that related? Against Peace Health, who can? ACLU, the Eugene Emergency Efficiency Group, and more. So give us just a little bit more of what you think can happen around what's happening in Peace Health.
So, as I mentioned earlier, unfortunately, the way that the corporate practice of medicine enforcement mechanism is structured is an individual right of action. So, the right to sue. And Eugene emergency providers have started that process, and they're getting very good support with that process. So that is the mechanism that we have right now, and that is one of the pieces that I think is really critical to change in the corporate practice of medicine law. Unfortunately, as I mentioned earlier, we don't have the time to wait, right? We need something that will happen very quickly. And one of the things that we are trying to do is to pressure Peace Health and Apollo MD to go through a full healthcare management oversight process, go through a full HCMO review. We've made multiple requests by letter. We've made requests through the governor's office asking them to do this. We cannot compel them to do this, and they have repeatedly said that they do not feel that they need to go through that process. And unfortunately, they're very familiar with the process. They've been through it before for other things. So we have the private right of action with Eugene emergency providers. That's happening. And so we don't have, and I should qualify, we do have support from the DOJ. So the attorney, he can't specifically take action himself, but the Attorney General, Dan Rayfield, has been consulting very closely with the governor's office about what can and could happen. So they have been engaged in this issue. They do not have the legal ability to be the enforcement mechanism. So what the governor has been looking at are what are the avenues that she has and that OHA has to basically compel Peace Health and Apollo MD to participate in a full HCMO review, or to basically stop the transaction altogether, or delay it until a full HCMO review can occur. And some of the areas that she's looking at has to do with some of the Oregon Health Authority governance ability around continuation of services, right? So if they can prove that there will be an interruption to emergency health care services, particularly if there are diversions to other places of people seeking care at Peace Health, if they can prove that they don't have, if OHA can prove they don't have a plan in place for those diversions, then that is one place that the governor could implement some type of executive decision, or OHA could implement an emergency rule. OHA does have rulemaking authority in some of these areas, but it's very narrow. And right now they feel like, based on the information that they have gotten, and it's been coming in drabs and pieces, as we continually pressure for greater transparency, but we still don't have a full picture. We still don't have an understanding of the RFP process, right? They have not provided us with the amount of information that we need for OHA and the governor to fully evaluate what the situation is. And that's from my perspective, that is a game that is often played, right, in these types of situations. So we can't concretely decide what the next steps are, but the governor is looking at how she can do something. Yeah.
Thank you for that level of detail. You all now know that full story. So that we're coming to the end.
Okay.
I have one other question from someone who, that is unrelated to healthcare. So if you could stay around a little while and talk to Mr. Graves about House Bill 4108, is that okay out there? And that has to do.
Yeah, sure.
Okay. And then, Lori, do you mind staying for a little while in case people kind of have some questions? So thank you all for being in the room. That is coming to a conclusion. I want to thank both Lisa and Lori for being in the room with us today. I'm being informal. Is that okay?
Yeah, absolutely.
Thank you so much. Thank you